Now, the American actress and author once said, I came to parenting the way most of us do, knowing nothing and trying to learn everything. And that may resonate with some of you who are parents in the audience. And in fact, there's a whole raft of psychological literature that demonstrates the hugely important role of parenting when it comes to our children's well-being, when it comes to their education, their socialization, and so on. There's also literature that shows that if that is disrupted or interrupted in some way, that can have a really negative impact on our children, not only in the here and now, but also actually through childhood into adolescence and possibly also into adulthood. So really, that was kind of the starting point for our project, because one of those disruptors is actually parental mental health. And this was the focus of our Primera project, an acronym for Promoting Research and Innovation in Mental Health Services. Families is one of a portfolio of projects, in fact, that we do in the Centre for Mental Health and Community Research. By way of context, the statistics here are actually quite alarming because parental mental illness is very common. We know that about 23% of children have or have had a parent, or maybe even two, with a mental health problem. We also know that this increases dramatically their own chances of developing mental health problems, as well as a whole range of other issues, physical health issues, poor educational outcomes, poor occupational outcomes, and so on. The problem is that many of these children are invisible. They are not identified or supported by mental health services for a whole number of reasons, and not just in Ireland but elsewhere as well. Policy and practice guidance is not there. The adult mental health and child and adolescent mental health services don't tend to work together. They work in very siloed ways, individualised ways, and there are issues around competency and confidentiality and so on as well. So what does that mean? It means that there are gaps in provision when it comes to family-focused practice. So we set out to find out, well, what's happening in Ireland in this space? What are we doing to support these vulnerable families? Well, we quickly learned not very much. Little or nothing, in fact, is happening in Ireland in this space. So we set about trying to change that in our own small way. And we identified a programme called Family Talk, an evidence-based programme called Family Talk. And we set about working hand in glove with mental health services across the country to try to get them to buy into this programme, to think about delivering it, and then to hopefully refer their families to us so that we could evaluate how this programme was working in an Irish context. And our broader aim here was to actually change hearts and minds, change the ways in which services were working, and hoping to nudge them toward family-focused practice. So what does the programme look like? Briefly on the slide, it's very strengths-based. It runs for about 10 weeks. There's a whole lot of relationship building around that. It's a whole family approach. It ticks a number of boxes in terms of being suitable for many different types of mental health problems. The training is about 10 hours. It's free. It's online. There's a whole suite of resources. And importantly, it's been adopted as part of the national initiatives in countries such as Australia and Scandinavia, and also the US. And Australia and Scandinavia are very progressive in terms of their mental health services and so on. What do we do? 5 years work. And I should have mentioned this project was funded by the HSE, one of the largest, in fact, that they've ever funded. 5 years work on one slide. I mentioned the scoping piece. So we worked to implement this programme, this Family Talk programme. We did it using gold standard methods. So we randomly allocated families to the Family Talk intervention and to a waitlist control. We then followed both these families up over time to assess them and how they were faring. So we had over 350 actually, parents and children, 86 families. This happened during COVID, so it affected our numbers, unfortunately, but still we did pretty well. We also did interviews, a whole series of interviews with families, clinicians, service providers, trying to find out what they thought of the programme. And as a sidebar, we also interviewed some adult children of parents who had a parent with a mental health problem or a mental illness, diagnosed mental illness, and that dramatically illustrated, in fact, the intergenerational impact of these kinds of problems. Just a very quick flavour of what we found. We assessed a lot of things. You can see here that in our intervention group, the kids in these families who participated in the programme had fewer behavioural and emotional problems. The parents' mental health improved. They also had better mental health literacy in the sense that they were more familiar, they became more familiar with their condition, with the impact of their condition on their families. The kids understood better why mummy was sick, why she had to go into hospital, what was going on. And the family relationships and functioning also improved along the way. I mentioned the interviews with families, some recurring themes here and some quotes there from partners and parents and kids. We saw improved family relationships. The important thing here was giving children a voice and giving parents a voice, opening up those conversations that typically wouldn't happen, and alleviating all the kind of guilt and worry and anxiety and stigma that associates with these kinds of problems in families. What better way to show you what service users thought than to let you hear from a few of our research participants.
I was very lucky to find this, to be involved in this, and I know there's a lot more people that need it as well that they don't know it's there. When I was lost, searching up things, there's all different kind of answers, and I think there needs to be more and more links for people to find this kind of therapy.
I would advise other families that have mental health issues, children or adults, to go and talk to someone and not body it up just to make it more easier to communicate with their children.
I would recommend the Family Talk programme. I thought it was hugely beneficial. It repaired relationships within my family unit. It was huge for us, so I couldn't recommend it enough. Just to get the ball rolling, to talk to somebody.
Many thanks to Gary, Laura and Emily for taking part in that, and the longer video is on our website. I want to take a quick moment just to thank the fantastic Premier Research team. We've just learned that we've been shortlisted for an award by the UK Association of Child and Adolescent Mental Health, so we're keeping our fingers crossed on that. There's just a few of our papers and there are more to follow, and thank you for listening.